So the way I look at CLL these days is we either have what I call a standard risk CLL. Well, these are patients who don't have high risk features. And then we have high risk CLL. And those are patients who either have a high risk molecular marker, or they may not have that marker, but their disease progressed on some of our good drugs. So that would be a high risk disease, right? So if you have somebody whose disease came back after one or two lines of best treatments, that's a difficult disease. So for standard risk CLL, we're focusing on making treatment time limited and less toxic. And I kind of mentioned the studies. For high risk, there's much more to do, and we still need treatment strategies that are more effective. So as I mentioned earlier, one of the things that we have been doing here, and some major centers, you can find other centers too. What I mean is like really having a program that doesn't focus on a treatment modality. It focuses on a strategy, right? So if I only have one tool to treat the disease, I will play with that tool in many different ways. But if I have access to 4 different tools, then I will give up tool 1 if I don't feel it's working, and I use that. So I guess my point is, as a center that has access to novel agents, chemotherapy rarely, but I mean, everybody has it. Cellular therapy could be bispecific therapy, or more importantly, we're very active in CAR T-cell therapy, and then if needed for selected patients, allogeneic stem cell transplant. I think that it's very critical to know how to sequence these treatments. What is the right time to jump from one to the other one? And again, I repeat, this is not for everybody. I mean, majority of our patients these days, we're fortunate, they fit in the standard category, and we have work to do there, but a different type of work. But for high-risk patients, I think it's very important to have a strategy and not just go on a treatment. Oh, it's working, I'm going to forget about CLL until I need it. No. Sometimes the time to move on to another treatment is when you're responding to a treatment and everything is fine. So that's why kind of having a plan for your disease and having a kind of a more general big picture vision is very important. And that's my maybe advice for patients with high risk patients, or with high risk disease.